Hello everyone. Today in this video we are going to discuss about neonatal jaundice, which is one of the commonest problems that we encounter among newborn babies. So let us discuss what are the factors leading to neonatal jaundice, what are the common risk factors, how does one identify jaundice in newborns, and what are the ways to effectively prevent and treat neonatal jaundice. Neonatal jaundice is a condition which is characterized by yellowish discoloration of a newborn baby's skin and eyes. This is caused by the accumulation of a chemical or a substance called as bilirubin, which tends to increase in the levels of the newborn baby's blood. To some extent, we can say that almost every baby has milder degrees of jaundice. So, the exact level of elevation of this substance called as bilirubin determines whether jaundice in a certain baby requires treatment or does not require treatment. When bilirubin levels rise in the blood to a certain extent, it tends to get deposited in the skin, the eyes, the gums of the baby, leading to the yellowish color that we can appreciate. The commonest symptom of neonatal jaundice is the yellowish color of the skin itself. This can be appreciated in natural sunlight better than artificial light. While looking for jaundice, we press the newborn baby's skin over some bony prominences, like for instance the chest bone or the forehead bone, and the skin becomes blanched, allowing us to appreciate the yellow color of the underlying skin. Now when we do this, we will be able to appreciate whether the yellowish tinge is mild or whether it is deeply yellow in color, like lemon yellow in color. Also, the extent of this yellow color over the skin helps us to determine the approximate level of the bilirubin. For instance, if yellowish color is only present over the baby's face and the upper chest, then the levels will be around 5 to 8 milligrams per deciliter, whereas if the yellowish color even extends to the lower part of the legs and involves the baby's palms and soles, etc., then the level of bilirubin is likely to be higher, typically more than 15. So this is about the symptoms of jaundice. Now, although jaundice is a very common and simple problem in newborn babies, it can become problematic when the levels become very high. Say if the levels are more than 20 to 25 milligrams, even among term healthy babies, there can be some problems created simply because of the high levels of bilirubin. These include poor feeding, decreased activity, decreased sucking when the baby attempts breastfeeding, decreased urine output, abnormal body movements, abnormal posture of the baby, and sometimes even fever and high-pitched cry. Newborn babies in general are very vulnerable for developing milder elevations of jaundice in general, and some babies can develop more higher levels of bilirubin, culminating in significant hyperbilirubinemia or jaundice. Hyperbilirubinemia being the technical term for jaundice. So why do newborn babies develop jaundice? This is because normal RBC load or red blood cell load in newborn babies is higher than that in adults. So the red cell count or red cell number as well as hemoglobin is naturally higher in newborn babies when compared to adults such as us. So when these red blood cells break down normally, the substance called bilirubin is normally produced. This is the reason that newborn babies are more vulnerable to develop jaundice. Some factors in addition predispose some babies to develop higher levels of jaundice, such as babies who have bruising, or babies who have small blood clots called hematoma, which are formed during the process of delivery, to babies where mother and baby belong to different groups. Commonly when the mother has a Rh negative group and baby is Rh positive, or when the mother is O group and the baby is A, B or AB group. So this leads to incompatibility of blood group, and some antibodies can be transmitted from the mother to the baby, leading to more breakdown of these red blood cells. Thirdly, some babies can lack some enzymes. Particularly, there is an enzyme called as D6PD, glucose 6-phosphate dehydrogenase. So the deficiency of this enzyme can also lead to increased tendency for the red blood cells to break down. So a culmination of all these various factors, along with the naturally higher red blood cell volume in newborn babies, predisposes them to jaundice. So there are two important techniques to identify the levels of jaundice in the baby. So we discussed that jaundice can be detected by simply examining the baby in natural light like sunlight. Like if the jaundice is only present over the face and the chest, the levels of bilirubin will be lower when compared to the jaundice extending over the entire body, the face, chest, abdomen, the lower part of the legs and including the palms and the soles, when the level is likely to be higher. One has to confirm the exact level of bilirubin before deciding whether the baby requires treatment or not. This is done by two techniques. One is by doing a simple blood test called as serum bilirubin or total serum bilirubin, TSB. This blood test involves taking or drawing a small volume of blood sample, which is usually between 0.5 to 1 ml, and this is subjected to a common lab test, and we generally get the value in milligrams per deciliter within 2 hours or so. The other way of testing for jaundice levels is transcutaneous bilirubin, wherein without having to prick the baby, we can use a handy handheld portable device called as a transcutaneous bilirubinometer to assess the levels of the bilirubin by placing this equipment over the newborn baby's skin, commonly over the forehead and the chest. So these are the two techniques which are used for assessing the level of bilirubin. Usually we need a blood sample or a total serum bilirubin to decide whether the baby requires phototherapy. The gold standard for treatment of significant jaundice or significant hyperbilirubinemia remains phototherapy. Phototherapy is a technique wherein lights which are of special blue spectrum or blue-green wavelength are used or placed over the newborn baby, and this light results in the breakdown of this bilirubin to simpler and water-soluble products which can be easily removed from the body in the urine as well as in the stools of the baby. Phototherapy is a time-tested and safe technique to treat neonatal jaundice, and these days we have more effective lights called as LED or light emitting diodes, which are capable of giving phototherapy, which is not only effective but also safer and better tolerated by the babies. Usually whenever one starts phototherapy, which is typically given in the hospital setting, the baby must be fed regularly, because it is important to ensure that the baby passes adequate urine and stools. It is also important to give phototherapy continuously without interruption. The interruption is only allowed when the baby has to be breastfed. During all other times, the baby should be continued on uninterrupted phototherapy. Usually, doctors will repeat the blood sample after few hours of giving phototherapy to assess whether there is satisfactory response in the form of decrease in serum bilirubin levels or not. Yes, jaundice can be prevented to some extent. Although nearly all newborn babies will have some elevation of bilirubin or milder levels of jaundice, significant or serious elevation in bilirubin levels can be reasonably prevented by few strategies. First strategy is feeding the baby regularly. Second strategy is to screen the baby before the baby's discharge. So first strategy, ensure that the baby is breastfed regularly and optimally. Adequate feeding helps the baby to pass urine and stools regularly, and the bilirubin levels will be automatically reduced because bilirubin is excreted from the body in both urine and stool. The second strategy is, before getting discharged from the hospital, most hospitals, including ours, will screen the baby's levels of jaundice either by a good thorough clinical examination of the baby or by using either the skin test, transcutaneous bilirubinometer, or a serum bilirubin will be assessed before the baby is discharged from the hospital to determine when you should come back for a prompt and early follow-up. Prompt diagnosis, screening and effective treatment with phototherapy can be used to reduce the dangers of serious elevation of serum bilirubin as much as possible. Hence, early screening, early detection, prompt feeding and effective treatment of jaundice with phototherapy will go a long way in managing this common problem seen in newborn babies. Thank you.